Get rid. Hello. So good afternoon. This is today we will show a very nice case. We have a patient, a female with ¿cuántos años tiene? 54 years old, with a short Barrett's esophagus. That previously, 3 months before, she had a high-grade dysplasia. So normally in these patients, we give a treatment with PPI to 40 milligrams twice a day and after the treatment we review the patient. In our unit we use confocal to evaluate very well to have a decision, because this is a very short Barrett's esophagus. I use my optical magnification also to try to evaluate this area. This is the suspected area. You can see here a very short Barrett's esophagus, but there is not more. There is a loss of architecture in this point. You can see here. So a lot of vessel and no pit pattern, as you can see in the other areas. So this is a very short Barrett's esophagus with low-grade dysplasia, as we see on confocal. So this is another part of the Barrett's esophagus that she have. She have a very short Barrett's esophagus. There's no big mistake here. I need to show you the areas. Barrett's esophagus here at the confocal. This is an area with low-grade dysplasia. You can see. This is squamous epithelium. It's a very nice image. Very nice image of this Barrett's esophagus. So there are some areas with hyperchromatic nucleo. You can see here, this is the transition between the squamous and Barrett's esophagus. It's a very short Barrett's esophagus. So this is a small area of low-grade dysplasia also here. So we are very clear that this patient have quiero ver la imagen endoscópica, okay? So we are very sure that this patient have low-grade dysplasia in spite of the treatment, and now we can offer for these patients a special kind of treatment with low risk, that is Barret's. We can do a radiofrequency of this area, that is the suspected area, and I will treat also the other small areas of Barrett's esophagus that she have. So I was using optical enhancement with optical magnification. Now I will prepare my radio frequency now. So it's a small catheter. We will use the Alloflex from Medtronic. So as you can see here, this is a small radio frequency ablation method, and so we need to put here like that. So you need to put that at the level of the tentacle. Now it's okay. We need to see the optical very well, and always the radio frequency needs to be at the level of the working channel, okay? So if not, okay. If not, we cannot see very well, so it's very important to have the vision. Okay, now we are very good. Sometimes could be a little bit difficult to pass, but it's not so difficult. If you work very well with your patient, there will not be any reason to have difficulties. And this is a very short Barret's esophagus, huh? It's really incredible. I prefer to use the optical magnification just to identify very well the area. Sometimes you can use also you can do some marks. I think it's here. Okay, let's go to treat here. Puedes bajar un poquito la cámara. O levantar, no, levantar la televisor. Bajamos un poquito la cámara. Vamos a consigo ver. So when we do the ablation, I think it's easier when you have a large Barret's esophagus. The problem is when you have a short Barret's esophagus. Becomes difficult. It's here. It's very short. Okay. Now we are good. So I will apply. Okay, I'm with the mucosa. And once I am with the contact with the mucosa, in this case, so you can see here the result of the ablation. I will turn a little bit more. Here, this is part is very important. As I told you, it's a little bit difficult when you work with small, short segments of Barrett's esophagus. And now we'll turn a little bit more. Oh, perfect. So it's very useful to deflate when you are in the good position. Perfect. I think we almost finished. I just want to be sure in this area. This is a difficult area. Now we need to clean. You see, very well. Perfect. Perfect. Very nice ablation. I will try to clean here also. And here. Okay. So we finish. It was just to show you the utility of radiofrequency in this kind of patients. Ok, desconecta por favor. Voy a apagarlo. Hala. Let's go to see quickly. Just to be sure. You see, this is the complete ablation. So very nice ablation. No more Barrett. Necesito agua. Perfect. Okay. Una foto. Perfecto. See? So this is a very good ablation. We will see in a few weeks, in 8 weeks at least, the results of this ablation. And probably the follow-up will change in this patient now. We will start to give a treatment with PPIs also. Okay, thank you so much. Cerramos la transmisión, por favor.